Hi, I'm Dr. Nan of Fireside Pediatrics and Personal Medicine International. I'm a concierge pediatrician. That means I do house calls. I also communicate with patients by way of email, phone advice, and telemedicine visits. What's that, you say? What's a telemedicine visit? Don't feel bad. It's one of the most commonly asked questions I get. Telemedicine is a way of doing a patient visit through a computer screen. It's similar to Skype, but through a secure portal. It's commonly used in ICU in rural settings. It's a way of linking the patient with a physician who's geographically distant from them. The wonder of the internet age is that nobody's really geographically distant anymore. Information from an ICU monitor can be transmitted to a specialist who's the top person in that field halfway around the world. In rural settings, it's used to link patients to their specialists for management of chronic illnesses. It can also be used to monitor those same illnesses. It's HIPAA and AMA compliant, following all the rules and regulations, and it's completely legal. Sorry? You point out that I don't practice in an ICU or a rural setting? You're right. Now you want to know how this is going to be pertinent to an urban mom with a sick child. And that's an excellent point. Say your child gets sick in the middle of the night and you need to talk to a doctor. If you call, you might reach a physician, but you're more likely going to have to settle for speaking with an advice nurse or an answering service. If you do get the physician, she may tell you that she can't manage your child's problem over the phone. It needs a higher level of care. And then she gives you the choice of either waiting until the next day or going to the emergency department. That's a difficult position to be in as a parent. This is where I swoop in and save the day, or night, as the case may be. Through telemedicine, I can offer you that higher level of service. Through the wonder of the digital age, I can look through the computer screen and see your child and get a much better idea of just how sick they are. And sometimes that's all that's needed. Other times I'm looking for something specific, like pink eye or a rash. Then, once I have that specific information, I can give you more specific advice. Often, I can tell you whether or not that visit the next day is necessary. Usually, I can tell you that the ER visit is not, and occasionally, I can send out a prescription to start treatment that night. What? That example isn't enough for you? Try this one. Your son wakes up with a fever of 102 degrees and a sore throat. He was fine when he went to bed last night. Now what? Do you send him to school and see how he does? Or do you call your physician's office and try to get him an appointment? Why don't you call me and we'll do a telemedicine visit? Through the computer, I can determine whether or not your child needs a strep test. If so, a requisition is electronically sent to a nearby lab or a nearby children's hospital. You take your child there, you get the test done, and you take him home and you tuck him back in bed. Within an hour, I have results, and we can determine whether or not he can go to school or if treatment needs to be started. If treatment does need to be started, I can electronically send a prescription to your nearest favorite pharmacy. Telemedicine is a quicker way of managing some problems than a typical office visit. Yes, perhaps your physician has a laboratory right there in his building. He may even be able to do a strep test right in his office. But you're still going to have to go to that waiting room and sit there with other people who are ill. You may only have to wait a few minutes, but more than likely you're going to have to wait until an hour after your appointment time. Then, if it's flu season, your child might not get to see their own provider at all. They may have to see somebody they've never met. Telemedicine is quick, convenient, and preserves continuity of care. Not everything can or should be handled by a telemedicine visit. Please allow your provider to help you in making that decision as to whether or not that's what's indicated. Sometimes an office visit is more appropriate. I hope this has helped you to see what telemedicine is and what it can do for you. It's quick, convenient, and maintains continuity of care. For more information, please contact your personal medicine provider at www.personalmedicine.com.